One of the things that we see very often in this clinic is people suffering from low levels of B12. When we test for B12, and there's the traditional testing for B12, which is usually very inaccurate. But when we test for B12, we often use a saliva test along with a blood test. And what we're finding is that a lot of people have trouble with B12. And here's the reason. If anyone has any kind of digestive issues at all, and if they just have, extra, maybe acid, they take any acid reducing medications, a lot of medications reduce people's levels of B12. And here are people that just, if they don't have what they call the intrinsic factor, which is a protein that they need in order to break down B12. Well, you know what? They're estimating now that over 40% of the population have low levels of B12. If you have low levels of B12, there's a lot of things that are going to happen. One of them is cognitive issues. You will have a brain fog. You won't feel quite as good. You'll be sucking for air. A lot of people are just constantly, because B12 really delivers a lot of oxygen. You just will be lethargic. It can really affect your sleep. B12 is very important it's such an important vitamin that, it's essential that you have good levels. We have a product, a sublingual. By the way, they have shown that when you take a sublingual, which means under the tongue, B12, let it dissolve in your mouth, that it's more effective than taking a B12 shot. And a lot of people take a B12 and yet they swallow it and they don't get that B12 at all. So we at the Martin Clinic have developed a 5,000 microgram B12, which is like taking a B12 shot, that dissolves rapidly in your mouth, goes directly to your bloodstream, and really elevates your levels of B12 in a short period of time.